justice and the impact of structural racism on health outcomes. So thank you all for being with us today. So before we get into our conversation, I want to just go over a couple of logistics. So we're streaming live right now on both LinkedIn Live and YouTube. So wherever you're joining us from, thank you for joining us. And this episode is going to be recorded and will be available publicly available later on today. I also want to shout out the Robert Wood Johnson Foundation for giving us this platform, and the unscripted freedom to talk shop as researchers. So we're gonna, lay it out on the line, or as they say in football, leave it all on the field. While I'm in conversation with Dr. Bassett, I invite you to also be in conversation with each other using the chat. And I'm going to get you started with the question. So I don't know if you guys can see my background. I have lots of food art. I'm very inspired by food art. So my first question to you is food art inspired. If you were a frozen meal, what would be your contents? So if you can't see it, but directly in front of me is a huge frozen meal painting from one of my favorite artists. So it has fried chicken and mashed potatoes, but I'm just curious about if you were a frozen meal, what would be in your little trays? And I want to also talk about some community guidelines. Please keep in mind these community guidelines. Refrain from discussing things like election campaigns, candidates, or political party platforms in the chat. But yes, you can be very candid and you can ask us tough questions, ask yourselves tough questions. And I want you to push each other to use what we call radical imagination. We want all of that. So I also want to talk about just a little bit before. So, usually like yesterday when I did this, I kind of kept an eye on the chat, but I really didn't engage in the chat. So I will keep my eye on the chat, but I'm going to just focus my conversation with Dr. Bassett. And before we get started with all of the questions, I just want to talk about our Put It on a Shirt campaign. So we're trying this little fun thing with Unscripted that you can be a part of. It's called Put It on a Shirt. So we're going to put our words and our conversations on a t-shirt. And hopefully these t-shirts will spark some conversation in your day-to-day lives. So if you hear something that we say, I want you to put in the chat, put it on a shirt, So like if you hear something, if there's a quote that either myself or Dr. Bassett says that you think deserves to be on a shirt, just write in the chat that comment and put it on the shirt. And so the really about that is that the Robert Wood Johnson Foundation will design one really cool shirt from each of the episodes. And the shirt will be available tomorrow for you to pre-order for you to be able to pre-order, and there's going to be up to 200 shirts available. And so we hope that you'll have fun with it. Like I said, I think it's a really cool aspect. I ordered a t-shirt for yesterday and I can't wait to wear mine. But anyway, let's start the conversation. I'm excited. So Dr. Bassett, thank you so much for taking the time to talk to me. I'm so excited to talk to you. I wanted to start by saying that a large part of this conversation has been inspired by your TED Med talk back in 2015. Not only did I find your words powerful, I found them to be kind of prophetic. So I'm going to center today's conversation around that. And I want to talk about something that you said. So just to set the stage for everyone, if you haven't seen the TED Med talk, I think you definitely should. But just to set the scenery, Dr. Bassett was talking about her experiences in Zimbabwe around the AIDS epidemic in like 1985. And you made a comment and you said that, and I quote, I didn't see my role as an advocacy or political one. I was there for my technical skills, both my clinical and my research epidemiological skills. And I thought that was funny that you were in this moment, this epidemic, and you said that, I didn't see my role as one of an advocate or a political one. I was just there to do my job, even though you also mentioned that you were aware of other things that were going on the ground that could have contributed to what was going on. I see so many parallels with my personal life. I spent a large amount of my academic career behind the ivory tower. And I remember I could literally see communities that needed my assistance right from my classroom window. And I just wanted to know that, what can tip the scale of us to actually see ourselves as advocates and see ourselves as as public health practitioners?
Well, first, thanks for the lovely introduction. And I just want to say one thing, and I will get to your question, is that it really means a lot to me to be in conversation with a young scholar activist like yourself. And the fact that there's a whole flock of you emerging now really gives me hope for the future. So I lived and worked in Zimbabwe for a long time, nearly 20 years. It was my home, but I was a foreigner. Although I held a faculty position at the University of Zimbabwe, Zimbabwe had one of the worst AIDS epidemics in the world. And Africa, as a continent, was the only part of the world that had a generalized population epidemic. But part of my being quiet had to do with the fact that I was a perennial outsider. Which I think many of us, regardless of where we come from, by the time we get finished with all these degrees, I lived my early life in New York City public housing. Probably nobody would guess that about me now, because by the time we finish with all these degrees, we all sort of confront some of the outsider status compared to the communities from which we may have come. So for me, it was the catastrophic impact of the HIV epidemic that made me, in retrospect, regret that I hadn't been more outspoken. So, 20% of adults were thought to be HIV positive. If you can imagine that, you'd run into people in the supermarket who you knew and see telltale signs. So when I returned to the United States, I decided that I wouldn't ever make the same mistake again. And what I saw when I came back to the United States was that the conversation about race and racism had virtually vanished. I came back in the early 2000s. And that was when I decided that this time, certainly I'm a citizen of this country. My roots, in terms of my descendants, go back probably to at least the 18th century, maybe the 17th century. And, I I feel like I have every right to speak. And I decided I would start doing that.
No, that's great. That's great. I was just thinking about my time when I was in the classroom. I too had that feeling like, even though I see these
Mm.
that need help, I didn't feel like I said, I also too felt like an outsider. So that's, how can we get beyond that? Because actually, a lot of these communities need our help, they need our assistance. And how can we become motivated to actually impact change in these communities? So from your talk, I felt like there were a lot of lessons that were learned during the AIDS epidemic. I'm sure, like you said, you learned to never not speak out. We learned how to think about things in a deeper way. But fast forward some 5 years after your TED talk, this is where I feel like your TED talk was very prophetic. We had another epidemic. It wasn't the AIDS epidemic, it was COVID. But I think that despite all of the lessons that we learned through the AIDS epidemic, I still felt like we did a really poor job with COVID, with the COVID response, especially from a public health practitioner point of view. And I'm going to set this question up for you. So I remember at the time when COVID happened, I was an adjunct. I was still in school, but I was also an adjunct. And I remember when they were like, okay, there's a pandemic, and they released everyone to go home. They're like, try to get home as fast as you could. I just remember in that moment, I saw students being afraid because they didn't have the money to get a plane ticket home. And I remember when I had my first Zoom class, I remember some of the students were Zooming in from the parking lot of a fast food restaurant because they didn't have internet access at home. So in that moment, I was very scared. I was like, I don't know. If we're not thinking about these small things now, I don't think that there's something that's going to happen. We're going to start thinking about these things later on. So despite all of what happened during the AIDS epidemic, why did we still do such a poor job with COVID?
Oh gosh, first of all, the fact is we did do a poor job. I don't think that that's some sort of gloomy assessment. Compared to other wealthy countries, we racked up many more deaths, many of which were clearly avoidable. We lost 1 million people and more during the COVID pandemic. And so there's no question that if our goal was to save lives, that we failed as a country and as a public health system. I think that, I actually wrote something about the analogies between the HIV epidemic and the COVID pandemic. And it was really about the way in which epidemics are social events. They're not just related to a virus and a host. They're related to the sets of exposures. And you work a lot on this in your own work that are driven by the organization of our society. And part of the role of research is to uncover the ways in which society intrudes on what is often described as a purely biological phenomena. And I would say that a lot of my work over it's been decades now, have been trying to unpack the fact that ill health has its roots in society and not just in biology.
And so, I think this COVID was one of those experiences that I think made me a little bitter. And I'm just going to be candid. So, first of all, that experience that I talked about in the schools when,
Being
kids
dumped.
were,
Basically, it
yes,
felt like you were being dumped, it sounds like.
yeah,
You
yeah,
guys, you all figure it out.
yeah,
Go home.
yeah, go home, and then realizing there wasn't a plan in place to think about things like, internet insecurity or financial reasons. Like, there are students here that depend on work study to pay their tuition or to, take care of their families. And so I knew that in that moment that if we weren't thinking about these things, we weren't going to be thinking about these things on a larger scale. This was a very small private liberal arts college I was adjuncting at. So, then I kind of take a step back and I think about, okay, that was my experience in that school. Then I think about the experience in my home state of Mississippi, born and raised in Jackson, Mississippi. And I remember that in the very beginning, Jackson, Mississippi was one of those places that was really most hit when it came to COVID. A lot of people were dying. And I just remember that at that time, Jackson was also undergoing a water crisis. And so the messaging was to prioritize things that were in direct opposition to what people were suffering on the ground. It's like, how can I prioritize going and getting vaccinated when I don't have clean water, or when my children are at home because school's been dismissed and I feel stuck, I don't have any way out of this. And so then I started looking at, well, what infrastructure is in Mississippi that we can use to help? And so I started seeing things like the Jackson Heart Study, which was the longest epidemiological study of African Americans in the nation, at least.
Mm-hmm.
They were just silent. I was just, like I say, when I'm bitter, I'm just kind of bitter about the fact that we didn't see these small, I don't want to call them small, but we didn't see these kind of connected issues that could lead to people following our advice. And then we had some infrastructure on the ground that really wasn't around when the community needed help. So I feel very conflicted as a public health practitioner, and like, why do we do that? I know you can't answer that question specifically, but yeah, why do we do that?
I can tell you what I think, and you probably know that I actually took a leave of absence from my job as a professor at Harvard and went to be the New York State Health Commissioner during COVID, partly because, actually largely because I was kind of tired of being a talking head. But I think you're talking about the ability of academia to mobilize its not inconsiderable resources in support of a response to a public health crisis. And some of that happened. We had members of the faculty on planning committees trying to figure out how to prioritize vaccination. With some of my fellows, we did an analysis showing, don't quote me on whether I'm getting this completely right, but I think a 55-year-old Latino woman had a much higher risk of dying of COVID than a 65-year-old white man. So, you remember the initial cutoff for getting vaccinated was being 65 years. So I think that was an important role of the academy to try and bring data to public policy discussions. But the research infrastructure that we would have hoped could be mobilized to support the response, it just doesn't work like that. And that's partly related to the whole structure of academic public health, that it's in support of individual research interests, which may or may not, and during the time of a pandemic, align with the pressing needs of public health. And, that's a big structural issue that has a lot to do with how young scholars like you confront the fact that you have to raise money to do your work from institutions that are, mostly interested in quite narrow research questions, like the National Institutes of Health. So turning an NIH-funded research apparatus into a rapid response is, really hard to do. Nonetheless, there were important facts that were revealed by people gathering to analyze public health data that the CDC should have been analyzing, but you'll remember that the CDC was really incapacitated in the first months of the pandemic, and making the point that we were seeing these huge racial and ethnic disparities in the risk of COVID infection and death. And so without those analyses, we wouldn't have known that. So I don't want anybody who is interested in research to think that people like you, and I know people, people like me, and I know people like you, don't see the value of research. We know that research has a value, but the problem is how its priorities are set and frankly, how it's funded. So those are where the challenges are.
Yep. And what about what we leave behind?
Mm.
So, when I talk about the Jackson Heart study, millions and millions and millions of dollars in, it's been in the community for, at that point, over 10 years. So what are we leaving behind? And what are we thinking about what we leave behind? Because I feel like each grant that we get, maybe we aren't able to mobilize as rapidly as we need to, but like, what are we, especially when we have things like structural racism, what are we leaving behind? What infrastructure are we leaving behind that people can build upon to improve their communities? I feel like, we write publications, but what can we leave behind to?
Well, part of I'm pretty sure you're leaving behind, and what I certainly in my government public health jobs have tried to cultivate is a notion of citizen scientists. The idea that, that the work that we do, the idea of trying to gather information about the health of a population or the kind of exposures that a population faces can be understood by anybody, and that we need to build the confidence and capacity of communities to engage with science. So I think that that's an important part of what we do, is try and demystify the idea that data can help us to create health. And so, I think always what we leave behind, there's infrastructure, there's stuff, there's people, and that's important, and there's systems. And I think to the extent that we work with community organizations that will be there when we leave and help build capacity to engage with research, we have left something behind.
Yeah, absolutely. Okay, so I'm going to go back to your TED Talk. So you talked about when you were in Zimbabwe speaking out about the things that you saw, like about the unequal access to life-saving drugs, or about the political systems that were driving infection. And I think that these are very, very, very important things. I'm not saying that all of us have to be activists and all of us have to be political, but I think these are very important things that if we see them, as I say, like, if you see something, say something, like when you get on the train. But like, so at that time, you did. I know you talked about a little bit about why, but what do you think, like, what could you tell us, for those of us who feel like we don't have the power to speak out? What kind of advice, what did you learn from that? And what kind of advice could you give us?
That's a really good question. I mean, I have to, I was a teenager in the 1960s. So we're talking about a different generational experience. But most of my working life, I disregarded advice from people who meant me well. When I finished a medical school, I wanted to go do my hospital training at Harlem Hospital, and I was told, that's a really bad idea. You could go to a top tier hospital. And I just decided that's where I was going. And I went. People told me it was not a great idea to go to Zimbabwe, certainly not to spend nearly 2 years there. So for me, following the things that I was passionate about meant that I was doing the things I was better at. And so it worked out. But I can't tell you that it would work out for everybody. But for me, it worked out. It's important for all of us to do things that we genuinely are passionate about. And that's what I did. Now, when I came back to the States, I got to be the New York City Health Commissioner. And I don't think I'd written about, I don't know whether I certainly hadn't written this when I did the TED Talk, and I always try to write with younger scholars. We had the opportunity to write something about the U.S. health terrain, and we decided from a health department that we were going to invoke structural racism. I think the editors were like, we would probably talk about biased behavior by clinicians or something, hospital segregation. But we decided that we were going to write something about structural racism and call for there to be more research on this topic. I think that it helped plant a flag, frankly, for people to see in the field. And of course, we had events on our side, tragic events. We had Ferguson, we had later the murder of George Floyd, for the world to see that the U.S. had a problem which it had not yet really fully engaged with.
Yeah. So. And the Jackson water crisis, it's just,
that's stunning, actually. And I don't fully understand. We could probably spend the rest of our conversation with to learn from you. But part of that story seems to be the ways in which our cities were segregated, the ways in which governments supported the emergence of wealthy white suburbs that were separate jurisdictions, different tax base, and allowed the gutting of a city like Jackson so that it, has a water system that it can't maintain. I mean, this is 19th century public health. This is, I just find it unthinkable, frankly. And yet it's what happened.
It's what happened. Exactly. So, another thing that I felt like that came out of the whole kind of COVID, COVID epidemic was us also realizing that we do a bad job of juggling many things at one time. And I kind of see that people who study climate change, I'm not knocking it at all, but it's kind of like we get into these silos. It's like, it's climate change, it's air pollution, it's these things. And we can't balance multiple things and multiple times, even though a lot of our problems are social, economic, racial, spatial, and so like why political? So why do we have a hard time juggling many things at one time?
Well, I think that one of the ways that we need scholars to help us is to help us connect these dots. Um, I saw somebody just put Bill Jenkins in the chat, and he was one of the people who helped expose the Tuskegee study, which staggeringly went on into the 1970s, long after these poor sharecroppers with untreated syphilis should have been treated. And then he went on to famously posed the question for me. It was a really succinct way of is it race or is it racism? And the idea here being in the US that race is so entrenched as a biological category. But now we have so many things that we can identify as the basis of marginalization and exclusion. There's no doubt that the climate crisis is going to have a racialized dimension, right? There's no doubt that when we talk about, I don't know, wages, that who's the lowest paid, least protected worker has varies along immigration status and racial ethnic classification. So we do need help linking these all up. And I don't think that anyone should call on people beginning careers in research to do everything. But what you can do is acknowledge the broader context in which your research takes place. I'm trying to think. We had Ebola. That wasn't an epidemic for us in the United States, but it took a terrible toll in West Africa. And to give you an idea of how a racial justice lens helped us in New York City, I was the commissioner at the time. People just started thinking that home health aides that came from Guinea or Liberia might have Ebola. I mean, nothing to do with having traveled, just having had a national identity. I don't know how they thought they were going to get Ebola without ever having been in an area where Ebola transmission was ongoing, but people were refusing to accept their home health aides. So we, as a health department, could reach out to communities. We could make clear the role of government in protecting people against discrimination. And I'm not sure that we would have done that if we hadn't had this kind of lens. So when you're talking about Jackson, it's really important that people not feel that they just simply have a failed government that hasn't been able to look after their interests, but see it in a broader context of how tax bases get eroded. Stuff like that. I think we don't have to be able to fix all the problems that we identify, but what we shouldn't do is be silent about them.
Yeah. And that was very apparent in your TED Talk. But I also feel too that I feel like there's something not sticking. And like I said, just disclaimer, everybody. I'm a jaded public health practitioner. I'm sort of a little bitter and jaded about I feel like we know what to do, but we don't know how to put it in a way that makes it work, because I have a feeling that the next pandemic that comes, we're going to have another conversation. Maybe it's not Dr. Walker and Dr. Bassett, but we're going to still be talking about this because we're not putting in the guardrails to actually learn from our mistakes and implement them and change. So I feel like something's not sticking. But okay,
Well,
I guess
I certainly, you and I were probably never trained in anything about communications, right? I mean, so that there are skills in how to, convey ideas that that certainly as a medical doctor, I was never trained in. But I do think that our challenge is bigger than a communications challenge. I mean,
Yeah.
I work mainly in government public health. I mean, I'm on an academic school of public health now, but, government public health has been undergoing budget cuts for 40 years. 40 years. We've lost something like 50,000 frontline health workers. So, all of this is tied up with, you create a government that can't function, and then you create a government that people don't trust. And we have this cycle. The solution isn't, in my view, and I hope that this isn't too political for our current conversation, to keep cutting the service that we hope will protect us in pandemics, but to not just throw money at them during a crisis, but to rebuild them and to build back the capacity that health departments once had. They had labs. New York City has a public health lab. New York State has a public health lab. They have huge amounts of data that tell us about the health of the population, and hardly any people who are really qualified to do careful analyses of those data. We need that capacity back.
Yeah, absolutely. So when you think, I'm going back to the beginning of our conversation when we were talking about me being in a classroom and looking out into a community. I see Mission Hill, which is the community I saw most. But when I was on a really high floor, I could see like all of Boston. So how do you get, and there's millions of us across universities, ivory towers across the nation that can look out and see communities that we most likely never engaged with. So what do we need to do to make us feel like we can we have something to offer? Or
Well, we do have something to offer.
but why do we stay back? Why do we
Well,
why
I
do we
mean,
stay
we've
back?
already talked about the kind of incentive structure for what gets funded, and what's viewed as a valid category of research. A lot of the things that interest me, for example, have to do with societal interventions. But probably it's much easier to get funded to look at a risk factor, or look at questions of healthy food. So, it's harder to get funding to study why we have maternity care deserts and why we have, so part of it is that. And then part of it is the fact that none of us have done as well as we should at reaching out to communities and asking them what they would consider their priority needs for research. And, the idea that communities are just passive recipients of all the bad news that you and I can enumerate is just wrong. People know, and we, we can do better. There are examples of us doing better. You're one of them, and I don't think that we should be too gloomy about this, but at the same time, the fact is that the problems are long and enduring, and it won't be a simple matter to move public health from hitching its wagon to the biological determinants of health, and start thinking more about how our societies create health.
Yep, exactly. And then also too, like, so as me as this student looking out into this community, what if like, so outside of the grant incentive structure and all of that kind of stuff, like, so ultimately I ended up working with Mission Hill, like I saw it,
Yeah, I know. I mean, I
it-
live in
yeah,
Roxbury, just down the hill from Mission
yeah.
Hill. I
So
mean, the data are staggering, right? The Back Bay, an affluent community, has probably a 20-year life expectancy gap with some
Yes.
of the census tracts in Roxbury.
Yes.
It used to
Yeah.
be 30 years, so I guess we could call that progress, and it is. But obviously, this is
Exactly.
one of the mantras of public health: progress and far to go.
Slow. So, okay, I guess to put a, like I said, I'm bitter and jaded, but to put a nice spin on things as we wrap up our conversation, I ended up working in Mission Hill. I did at that, it wasn't because I thought I was an activist. It wasn't because I thought I was going to be political. I was very interested in noise at the time, and went from my classroom piece of green space right in the middle of, like, I could see it from, like the 15th floor of FXB. And I saw a piece of green space. And I'm like, you know what? I'm going to go there. It looks like a very peaceful place. So like one day after class, I walked up to the top of the park. The park was called like the Fitzgerald Park. And it's this like really serene piece of real estate on top of Mission Hill. And I walked up to the top of it. And I remember I was able to see like the whole of Boston. And I remember looking at it and then listening and then just hearing it was super loud. And I'm like, I can't be the only one that hears sirens and like HVAC equipment. And so a guy was kind of standing next to me. I was like, "Do you hear that? Like, is it loud?" And like, say, "Yeah, it's loud. It's crazy. I've been here for many years." And he began to talk to me about some of the noise issues in the community. And I was like, "Is there anybody I could talk to? Because I have an idea." And he introduced me to the Mission Hill Health Movement. And so I ended up working in that community. Still, I'm not in Boston anymore, but still work with that, but at that still work with the community. But I wasn't, I didn't even think about, would this be grant funded or not? I didn't think about that. But can we just like walk into the community? Can we just like
I
be more
agree. Yeah.
sensitive, like more aware of what's going on around us, even if it's not directly tied to grant funding? Can we just know more about what's around us? Because I'm just going to share this too. During COVID and during the Jackson water crisis, they happened at the same time. I just remember seeing people who had published research about Jackson that were like literally right down the hall from me, who we never had a conversation about anything that was going on in Jackson. It was like they were disconnected. And so I guess I feel like we, as I guess my this long diatribe is just like, how can we feel connected to the place? It could be taking a walk and talking to people, but I feel like we really need to be connected. And how can we feel confident to be connected?
I think that the best case for it is that it makes our research better. If we do things the right way, meaning be attentive to the communities everyone who goes into public health, indeed anyone who goes into medicine, has a goal of improving health. But what we fail to really engage with is what creates health. And we have to believe that the communities that are burdened with health that is not what it should be care about these things. How could we think any different? And that they want to engage and collaborate to ensure that their health is better, that people pay attention to the noise levels. I mean, we have a former postdoc who's working on the idea of noise levels and affecting maternal health outcomes, for example, which, as you know, are really awful in the United States and not headed in the right direction, disproportionately affecting Black women. So your work is already, sort of filtering out that something that people think of as a nuisance noise is now being accepted as a community-wide exposure. I can't choose whether I'm listening to sirens right now in this over-policed neighborhood of Roxbury where I live. So this helps us get away from the idea that all health is personal choice. Yeah. That's been such a dominant paradigm. And it still, after 35 years in public health, remains one of the key things that I need to argue against. And so I think that people will find that their research is better if they begin having the conversations you had that day in Fitzgerald Park, and that their research has more impact.
No,
That's what
no,
I
thank
believe.
you.
I have to
No,
believe that.
I hope so. Like I said, disclaimer. I'm in this weird kind of public health mindset. I know I need to probably do some yoga and burn some incense, but like I'm more on the bitter side than anything. But this was great. This was a amazing conversation. Like I said, I've always wanted
Unscripted.
to very much so. So this is great. So I just want to make sure that everyone, if you, this is our last call to drop any kind of, put it on a t-shirt ideas. I think Dr. Bassett had so many amazing points, and that I think would go t-shirt. But I want to thank you guys so much for taking the time to listen to us. I want you to be on the lookout for an email later today that recaps our conversation, details about the conversation that Dr. Bassett will be leading tomorrow, and how to get your free t-shirt. So remember, there's only 200 t-shirts available. So make sure that you're keeping your eyes out for how to get one of those 200 t-shirts. But thank you all for joining us, and thank you, Dr. Bassett, for taking the time to talk to me. It truly was an honor. I feel kind of starstruck. You don't see all this sweat underneath my sweatshirt. I was very nervous.
I should tell people that I'm going to be talking to Brian Nosek.
Yeah, that's how.
And I had heard of you, Erica, just so you know. And our work does overlap, but Brian and I have fewer intersections. So I'm really looking forward to this conversation. He works on the idea that science should be open, that data shouldn't be secret, and that they should be that we should have open access to science. So I'm really looking forward to this conversation. I hope that those of you who've enjoyed our rambling today will join us again tomorrow.
And can I just be in the screen on the bottom? Like, can there be a third person on this conversation tomorrow? I can't wait to watch the conversation tomorrow. So if you guys have any topics that you would like for us to talk about, you can email unscripted@rwjf.org. And I hope to see you guys tomorrow. I'm going to be in the audience listening to you, Dr. Bassett. But with that, I would just like to say goodbye to everyone. Thank you so much for joining us today.
Thank you.